Good afternoon. Welcome to our work session. And tonight, leading us in our pledge will be Miss Lila Brown.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Miss Brown, very well done. Great job.
I move that she lead the pledge every meeting.
And Miss Brown is a first grader? Okay.
Get it right.
We're pleased to have you tonight. Thank you for that. With what has happened here in our state in Chattanooga, we are going to take a moment of silence to remember the families and those that lost their lives here recently. So, if ladies and gentlemen, if you'd join the board in a moment of silence. Thank you, and it's just a comprehensible tragedy, and those families will be in our prayers for quite some time. Okay, approval of the agenda. Any questions regarding the agenda? Seems like it's been a while since we've been together, so just make sure everybody has an opportunity to consider what you have before you. Board members, with the consent agenda, with your permission, Mr. Tackett has submitted 3 names that need to be added to the list. Isaac Haley from with Eagleville, with football. Again, these are non-faculty volunteers. Catherine Stone for Blackman Middle School with TRAP, and Deborah Moats with Eagleville Middle School with softball. Again, with your permission, we will add those names to the list, and they'll be on the list as of Thursday. Is that correct, Ms. Jordan? I'm sorry. I'm still on.
Quick one this week.
Yeah. We're moving right along this week. So, again, any questions or comments regarding the consent agenda and with the addition of those 3 names?
I'll just say that the consent agenda includes information about the Carl D. Perkins Career and Technical Education grant and our performance there. We continue to excel in that area, and it's one of the highlights of Rutherford County Schools. It's appropriate on the consent agenda, but it shouldn't go overlooked. The outstanding performance that happens in that area.
Thank you.
She actually applied, Ms. Nixon had done that, so she applied for us this time, so it's good that we got that reserve grant. I mean, that's extra monies, so.
Grateful for that. Okay. Of course, we'll pass through 6 and 7 till tomorrow night. We're ready for number 8.
Insurance report, I think we have invited tonight Ms. Melissa Stone. She would come up to, and some of your board members requested that she be on the agenda this evening. And glad to have you with us.
Thank you very much.
Welcome, and you are our Risk Management Director.
Yes, that's correct.
Again, we're grateful that you're here and for the information you're going to share with us, and also got quite the entourage with you too, so
right.
Hopefully all of our questions anyone who has a question, they'll be answered this evening. So again, thank you for taking time.
You're welcome.
Today.
She's also a parent of some students at Rutherford.
Well, there you go.
County.
That's true,
Two
too.
roles.
Vested partner. I appreciate the opportunity to come speak with you all. I began with Rutherford County in June of 2010. I believe this is the first time I've been invited, so I appreciate that opportunity to speak with you directly. I have brought individuals with me tonight, and I'll introduce them to you, and in a few minutes I'll explain to you what each of their roles and how we as a team work to improve the programs offered through the Insurance and Risk Management Department. Sherry Dodd is with me tonight. Many of you are probably familiar with Miss Dodd. She began in 2001 in Rutherford County, and she is an insurance administrator in the Risk Management Department. She is dedicated to the Board of Education. Your employees know her well. When they call, that is who they deal with. From the time of new hire through their tenure, as long as Miss Dodd is there, they have dealt with her and they know her very well, and we've received great feedback. Additionally, in my department, those who aren't with me tonight, is we have 7 individuals, including myself. 4 of those individuals are dedicated to insurance administration. Ms. Dodd is specific to the Board of Ed. We have Ms. Anderson, who works only on County General. We have 2 additional individuals who are support to the insurance administrators. And the remainder of the staff is a wellness and training coordinator and a safety specialist. So we manage over 5,000 people with very few resources in our department. And that's why these other individuals who are with me tonight are very important to the team. So with me tonight as well, I have Ms. Catherine Lee, who is a senior account manager with Cowan Benefits. She has been on our account for about a year now. With her is the COO and president and vice president of Cowan Benefits as well. I have Paul Huffman with me from Cigna, who is a senior account manager. I have with me from Premise Health, Mary Asher Branner, who is also a senior DSO with them. And then again, Ms. Dodd is with us as well. I've prepared some things for you tonight that we can walk through. I did watch the video from the work session to try to determine what information was important to you all. And so I have a few things that I would like to walk through with you. One of the things that I heard a comment about was the professional consulting services that we have utilized within Rutherford County, and that would be specific with Cowan Benefits. Their relationship began with Rutherford County in 2009, and they were awarded the bid for a product, and then that product became 2 products. And from there, they have also won additional bids as we have gone through the purchasing requirements. All of our bids are posted, our legal notices and all bids are posted. And they actually, as it pertains to the medical, dental, vision, they do not receive any commission from that. There is not any agent assigned to those particular product lines. Those are net commission arrangements that are a direct relationship between Rutherford County and Cigna. However, just to give you some background on how I've arrived at Rutherford County, unlike a lot of benefit managers who have an HR degree, I'm a little bit different. I actually worked for CNA Insurance Company, and I was their general manager of life and long-term claims operations. I was there for 6 years, running those lines of business from a claims perspective. From there, I went to a TPA out in Hendersonville that actually had Rutherford County for several years. It was known as William C. Biller and Company. I began that organization in October, and unfortunately in April of that year, under the name of Health Cost Solutions at that time, they lost the bid to Cigna. So I had a very short tenure with Rutherford County at the time, but I had previously met Ms. Dodd through that relationship. All of the other relationships are new to me since the time that I've come to Rutherford County. During the time I was at HCS, I was in senior leadership roles, which brings with me a little bit of a different background. I've negotiated all the contracts that it takes to run a benefits management program. We had a lot of clients that were local municipalities that I worked with. I've negotiated contracts, everything from pharmacy contracts to stop-loss contracts to lab arrangements and everything in between, the A to Z of what you all expect from Cigna. I've negotiated those contracts. That brings a different flavor to what my knowledge base is, and it also allows me to work very closely with Cowan Benefits in terms of, and Cigna, because we all speak the same language. So over the last 5 years, I've been able to utilize them with the limited staff that we have to be an extension to understand what the market's doing, to bounce ideas off. And because they are not receiving any commissions from the medical, dental, vision, they have no interest in trying to persuade me one way or the other. It is strictly based on the data, the experience, and what is occurring inside of our health plan that they've been able to work with me. Now, they have been here, as I said, prior to me coming in 2009, working closely with Rutherford County. What I have done is, my philosophy is that my ego isn't big enough that I need to be the only one in the spotlight. I'm willing to drag those along who are willing to come, because I feel like that they can add value. That's why I've invited all these individuals here tonight. If there's a question that I don't know the answer to, I'll be more than happy to have them come up and answer that for you. Likewise, whenever I have a question, I go to them and we look at data together and analyze and understand what we need to do in order to improve the plan. The medical claims will grow between 8 to 10% annually. That's what you see in the marketplace. You will see a pharmacy trend of about 11 to 12%. And what I've got for you here today is a survey that I'd like to cover very quickly. I know it's several pages, but I think it gives you a comparison to what the industry looks like to what Rutherford County looks like. And this would be one example of the type of information that I received from Cowan Benefits. As you can see, their logo is on it. They received both the Mercer and Kaiser surveys, so it gives, because they are in the broker market, they have several governments that are their particular clients, then they can give feedback that is helpful in trying to decide what to do within the county. So as we continue on to page 2, you'll see that from the national survey that over the past 3 years, employers offering consumer-directed health plans have risen from 17% to 23% of all employers. Among employers with 500-plus employees offering CDHPs jumped from 39% to 48%. Rutherford County began offering an HRA, Health Reimbursement Account, which would be considered one of these products, in 2009. In 2014, employees on average contributed 18% of the health insurance premium for single coverage and 29% of the premium for family coverage. Rutherford County single is 10% or 0 for our copay and deductible plan, and 0% for our HRA. So you can see that the county and Board of Education contributes much more than the national average towards employee premiums. For the family, we contribute 13% for the copay and deductible, or 3% for the HRA, compared to the 18 and 29% that's the national average. The average monthly premium for single PPO coverage in 2014 was $518, and the average monthly family PPO premium was $1,444. The average monthly premium for high deductible health plan coverage was $442 for a single, and the average monthly family premium was $1,283. Now, I won't read every page like this, but I think these are some important numbers to begin with. Rutherford County, compared to the $518 for single PPO, we're at $506 for the copay, and we are at $580 for the deductible on single coverage. For the copay family, we're at $1,467 and $1,682 for the deductible. Our HRA is at $366 for single and $1,063 for family. So you can see that we compare very competitively with national averages. Continuing on to page 3, our enrollment by plan. This shows you what government industry averages look like, and you can see majority of those are PPO, second to the HMO, followed by the high deductible health plan, then the POS and conventional insurance. Our enrollment in 2014 on page 4 shows you that our PPO coverage was 67.3% of plans, and 32.7% were high deductible health plans. On page 5, you can see the enrollment by plan for 2015. And you begin to see that our individuals are reacting to the educational pieces that we have done. Each year we look for better ways to improve the process of educating them. And you'll see that more are moving over to the high deductible health plan. 52.7% are in the PPO, 37.3% in the high deductible health plan. On page 6, 2014 average monthly health and pharmacy premium, or equivalent cost. If you'll look at government, the individual is at $530 a month, family is at $1,317. Rutherford County Range is 506, 580, and 366 for individual. And family is at 1277, 1464, and 1032, with only one of those numbers being higher than the average for governments. On page 7, it shows you the 2014 average employee contributions as a percentage for PPO plans. Government average is 14% individual, family is 26%. As I mentioned earlier, for our copay and deductible, we're at 10% on the single, 0% on the HRA. Our family coverage is a 13% employee contribution for both copay and deductible, and 3% for the HRA plan. On page 8, 2014 average monthly employee medical contributions in dollars. $80 for an individual, $283 for family. You'll see here, it will show you that it's $51. These are single rates. $51 for copay, $58 for deductible, $0 for the HRA. The family is at $283 for government. We're at $191 for copay, $219 for deductible, and $32 for the HRA. And again, that is the whole premium. That doesn't show what is actually being paid by the employee themselves. But it does show that our premiums are below the national average for government. The individual maximum out-of-pocket. Now, this is where we can talk a little bit more in depth in the enrollment guides that I've provided you. For government, the average is $2,500 in-network deductible out-of-pocket, $3,750 out-of-pocket for out-of-network. The county, as you can see, runs a little bit higher in some of its plans, so the copay plan is higher, and the HRA plan is higher. The HRA doesn't take into account what the county contributes towards that HRA, and I'll explain that a little bit later. And the only thing that we don't know on this particular one off the national survey is whether or not this PPO as a government median is a copay plan or a deductible plan, and a couple of other factors that would help you determine if these actual limits are consistent with the type of product that it is. So, but it's still a good visual aid. The one other thing to mention is that Rutherford County has the free employee health clinics where they can go receive acute and chronic care at no cost to them. And we don't know if this service is available on these other plans mentioned here. On the co-insurance, on the in and out of network, so this would be the amount they pay once deductible is reached. The government plans are at 20% inpatient, 40% outpatient, and Rutherford County is consistent with that, with the exception of the HRA, which is actually an improved plan for in-network at 10%, 40% out-of-network. Continuing on to page 11, you'll look at the employee office visit copays on the PPO plans. Government average is $20 for a private PCP, so primary care physician, and a specialist is $40. We are at $30 and $50, which is consistent with the state standard plan that they offer. And then the deductible plan is 20% after deductible, and then 10% after deductible on the HRA.
Is the 30/50, is that regular physician and specialized?
Right, so primary care physician is 30, that's your regular sniffles, right? And then the specialist would be 50, so that's like your cardiologist and specialized physicians like that. If you look at page 12, I have the median copays for generic drugs. And you can see Company C is Rutherford County. You can see that the government is at 10, 25, and 45. We're at 5, 30, and 60. The 60 is obviously the higher cost medications. For point of reference, the state is at 5, 30, or 60 for their preferred PPO, and they are at our partnership PPO, and they are at 10, 40, and 180 for the standard plan. On page 13, it talks about which services governments typically offer. So it shows an EAP, Employee Assistance Program, long-term care option, vision, and dental. Rutherford County offers all of these options to our employees. Continuing on to the next page, which is the percentage of employers offering consumer-driven health care plans. It shows that for governments, you can see in 2009 is when Rutherford County began offering theirs, and 26% of 1,000 to 5,000 employers with that many employees were offering it whenever Rutherford County. So that's a little progressive for us as a government entity, because you can see that only in 2008 there were 21%, and it's been a slow growth. So for us to jump in the market so soon, that gave a good viable option, and I'll explain why that's a good option for a lot of employees in a little bit. On page 15, it talked about percentage of employers offering particular wellness services, including gym membership discounts, smoking cessation, web-based health resources, wellness newsletters, lifestyle coaching, biometric screening, and weight loss programs. Put this in here just to let you know that we provide all of these either through our MedPoint clinics or our Smart Steps wellness program in Rutherford County to our employees. And then the last I put in here, just a defined contribution is where we as the employer say, we're going to give you X percent each month toward your insurance. That number may be $500. And then the employee will pay the difference. So if a premium is $1,200 and they really want that plan, we'll give them $500, then they have to pay the $700. So that's a defined contribution model. And this gives you the percentages of, what governments are considering doing that participated in the survey. So that's just a quick overview. I know that sometimes it feels very painful when these rate increases happen. I think this shows that even for as difficult as it's been, though, we have stayed in range, if not better, than other governments. So what I'd like to do is talk to you about one other thing that I heard in those discussions the other night, and that was about stop loss. I think Mr. Blair had explained that we're partially self-funded, and so I'd like to talk to you about what that really means. Let me see, if you'll look in your packet of information that's in your booklet there is one that I had prepared from 2010 to 2014. It's stop loss premium and performance, and it shows you that we had $380,000 as a retention level, and we are currently at, beginning in 2011, July 2011, $750,000. So what does that mean? That means for every person, child, spouse on our insurance, the County and Board of Education, out of its self-funded premium pool, will pay the first $750,000 on every person that is on our insurance program. Once it's over $750,000, then the excess risk carrier picks up and pays those particular claims. In terms of our claims, at the point that we moved from $380,000 to $750,000, we'd been trending exceptionally well. At the point that we moved, we had 2 rough years. That's the way it works sometimes, right? It's why it's called risk management. So you use data to make the best call that you can. We ended up with a high-cost claim, both in 2011 and in 2012. In some instances, or in both instances, it went well over the $750,000 cap that we had. So had we still remained at the $380,000, our stop loss rates would have went up even more than what we actually saw. You'll see that at the top of the list that we've trended well since 2012, with no claims going over the $750,000 in any of the years, and currently during this year we don't have one either. So it is just a risk management tool to kind of cap out your cost. We would have paid in excess of $1 million in both 2011 and 12 had we not had the stop loss insurance. So we've more than gotten our money back for the premiums that we have spent on stop loss. If you look at the open enrollment book, this book is just one of many, many pieces that we send out to employees during open enrollment. They receive this book, they receive a DVD with information that helps them understand what changes have taken place, what products are available to them. This is something that Cowan Benefits produces for us, and they work very closely. We come up with all of this. They have a company that they work with that we give them all the information. They make it look pretty, but we are the ones that finalize all the content in it, so it is specific to Rutherford County. And if you look on page 4, I'll give you a quick overview of the 3 plans that we have. So we have a copay plan, and that copay plan is good for employees who may live on a limited budget, who often won't go to the doctor because if they were in a deductible plan, that deductible is too high for them to pay at $500, and they can't afford to pay on a medical bill for 5 or 6 months. The copay plan has a set fee, so when they go to that primary care physician, they know going in the door, I'm going to pay $30. That $30 gets applied to their deductible, and when they walk out, they've only had to come up with $30 that day. They go to a specialist, they pay the $50. If they're hospitalized, that's where the deductible kicks in, and they have to meet the deductible before the insurance starts to pay. The pharmacy benefits on both the copay plan and the next plan, which is the deductible plan, are the same. The deductible plan doesn't pay anything until they meet their individual deductible, which is $500. Now, when I first started the county back in 2010, we had a $250 deductible plan and a $500 deductible plan. Well, that cannot serve well for a long period of time. They're too close together. And you can't keep your products the same and your premium differentials different, because what happens is you get adverse selection against your products. Plus, when you run the same product similarly, you're not addressing all the needs of the marketplace. So when we converted this to the $250 to the copay, that's what we did. There are a lot of employees that we would go out and educate about the HRA who were scared to make that jump. But the copay plan was a great option because it gave them that safety net, and they could better understand how their claims are going to trend for a year. And then, as you saw from the results of 2015, a lot have now made the jump over to the HRA. So the HRA is a health reimbursement account. It has a $1,750 single deductible rate amount, and it has a $3,500 family deductible amount. The county actually funds at Cigna $750 of the $1,750 single, and we fund $1,500 of the $3,500 deductible. So when an employee who is on the HRA goes to the doctor, and now if they go to MedPoint, it's free. So this doesn't matter to any of these plans. They can go there and receive the services. But if they go to their doctor and the doctor charges $100, that bill goes to Cigna, and they sweep it out of their HRA account. Once they have spent that $750, if it's a single enrollee, or if the family, if it's $1,500, once that money is gone, then they start to pay the remaining difference of that until they reach the deductible amount. At that time, it starts to pay at 90%, which is a 10% improvement over the copay and deductible plan and how it pays once those amounts are reached. As we sit down and we look at claims, we talk to employees, it helps them so much to see that the HRA is the best route to go. There's also, on mycigna.com, there's a tool that they can use. They can go in and plug what their claims experience is during open enrollment, and it helps them. It's a decision-making tool as well. We also go and have meetings and meet with them and educate people one-on-one. Recently, we went to the REA. We were invited there by Ms. Mitchell, and we met with teachers there. And every time that we have that opportunity to interact, we typically can have a success story or two out of that. Out of that particular meeting, I was able to help an individual, and I know Ms. Dodd has her own story, learn how to better facilitate the various programs we have in place. And through not changing anything in terms of the clinical services that they have, but where to obtain those services, they're going to save over $400 minimum a year out of their pocket. As a result of that meeting, I went back to Ms. Asherbranner and I said, hey, we need to do some targeted marketing. So a postcard went out recently to all the homes of our employees that told them how to better utilize the MedPoint services. If they have standing orders for labs or allergy injections or things like that, they can take an order from their primary care doctor and go to the clinic, and they can get those there. Saves them money, it saves us money. When you talk about, what drives our health rates and our increases, it is the cost of care and the utilization of services. We, as individuals who run this program for Rutherford County, can do everything in our power that we can do. But at the end of the day, the person who becomes sick and needs the service, where they decide to get that service also has a very major part in what our overall costs are. ER utilization used to be hot and heavy in the marketplace. People would not go out to the regular doctor. They would let it exacerbate. Next thing you know, they're in the emergency room, or they're using that as a primary care physician. That's why you see health plans now that have these large amounts out of pocket. It's a deterrent. It's to drive a consumer-based program. And as we see our HRA continue to increase year over year, we should see better success in the performance of our plan. When I first came to the county, we would have meetings. The 2011 rates were set when I came, so 2012 was the first opportunity I had to actually discuss premium rates. And we were tying the picture together too much. We were so focused on what is it going to cost on a per-month breakdown basis that we weren't getting the budget that we needed. And in order for a program like ours to be sustainable long-term, you got to have money in the bank. The amount of money that we need in order to pay our OPEB, our future liabilities, is astounding, and we're nowhere near it. Right now, we need to make sure that we have enough bills and enough money in the bank this year to pay all the bills that come in, because we owe that to the employees. I've had clients where they don't fund their self-funded program as they should. What happens is that employee goes to the doctor submits the bill over, right? They haven't funded that account at the TPA or at wherever their claims are processed. Next thing you know, you've got employees getting collections letters because the insurance isn't being paid. We have a fiduciary responsibility to make sure that the money is there. So we started those discussions of what does the budget need to be, and then who's going to pay what portion of the budget. If you'll look at, in your packet, there's a document here that says Cigna programs for Rutherford County. I'm not going to read all of these to you. But these are different programs available through Cigna that are all intended to engage the employee, improve the experience, and save cost. And you can see it's a very long list. Through our medical, our dental, our pharmacy, our vision, you can see all the various things that we have in place. I regularly work with Cigna on data needs and evaluation and things of that nature. Annually, we sit down and we look at our snapshot. You know, what do we look like this year? What's our claims trending as? And one thing that we do at the beginning of every year, starting in February, is we start to do premium calculations. I provided you with a sheet to give you an overview of the complexity of what it takes to determine premiums. It's more for demonstration purposes, but it shows you how much data and time it takes to get the numbers to where they want to be. And the reason this process occurs the way it is to make sure that we have the right amount of money to pay the projected claims. I've also provided in your packet for you a rate history sheet. And I know that, you hear our rates are astounding, they're out of control, what are we going to do? I heard in the meeting, if I understood it correctly, that somebody already knows we're getting a large rate increase next year, if I understood that correctly. I'm not quite sure I understood that, so if you know, that would be great if you could let me in on that, because I'm not quite sure where that one came from, or I misunderstood one.
We're talking about personal care that.
Yeah, on the blue, like the individual policies.
Right.
Yeah, that is definite, that's true.
Media is reporting some large increases as of January 1st.
That is true. And that's all response to the ACA and what those mandates are now, and what the individual market is doing. They have different controls in place than what we do in the group health plan as well. But if you look at the rate history sheet, you'll see I've put together 11 years here. And I've gone back and looked to say, all right, what did we do? I can tell you every time there's a 0 rate increase, we probably should have taken a rate increase, because your medical trends run an 8 to 10% annually. Now, if you annualize and annuitize this out from 2006 to 2016, even though we had a rough year, you'll see in 2014 was a rough year, right? we're at just a little over 5% on average every year. In 2008, there was a 5% rate increase, but the board actually absorbed that for their employees. So your employees didn't receive a rate increase that year. Beginning in 2013, the contributions began reducing by 1%. So even when we didn't take a rate increase, they would have seen a slight rate increase simply because of who was paying what part of the bill. But through here, out of these 11 years, I believe there's 7 of them where we've actually had a rate increase. In those 7 years, we've had one plan that actually had a reduction, and in not every plan in 7 years of rate increases did all plans get a rate increase. The other thing I've provided for you is the average spend by relationship. So this is a 5-year snapshot of what we are averaging in paying claims. 2010 for an employee, we averaged per employee on the plan paying $3,516 in claims that year. Now, someone could have had a $50,000 claim, somebody else had 0, obviously, but this is just average. So in 2014, for an employee, we paid $4,393. For every spouse on the plan, we paid $4,785. And for every dependent child, we paid $2,162. Inevitably, every open enrollment will get calls. People are upset because the employee plus child premium is lower than the employee plus spouse premium. And they will always say, those kids cost so much money. But this shows you that they really don't. They cost about half, right? Even if you have 5 kids on the plan, it's still, this is on a per child basis here. So I hope this information is useful to you. I just kind of guessed on what may be helpful as a jumping off point for discussion tonight, and I'm open to any questions, and I'll be glad to bring any one of the members from the team up here to talk to you all as well if it's something specific to what they do, services they provide, information that they have.
Ms. Moore?
Mayor, I do have several questions, Mr. Chairman. I appreciate all the information, and I've had a little bit of experience with large deductible and stop-loss programs, but it's been a little while, so you'll pardon me if some of this maybe is a little rusty, but I'm looking, first of all, at the stop-loss premium and performance page. And when I look at and understand these are strictly the premiums or the dollars, when you look up here, the paid claims that were paid by the stop-loss carrier. So we had obviously really, really challenging claims years in 2011 and 2012. Which I think would explain certainly, the rate increases there. But when I look at the claims years that we had for 13 and 14, and they were flat. In other words, if I'm reading those numbers correctly, the stop-loss carrier paid out no claims at all in 2014. Is that correct?
It is correct.
Which is awesome. Now, were they still paying on claims from previous years, or is that just dollars from that claims year?
That would be dollars from that year. However, stop-loss is a fully insured product.
Right.
And much like how we talked about with Blue Cross Blue Shield, what they're doing on their fully insured products, and they're taking a rate increase, that's why even on years where we see that we did not have any claims that year, we're going to experience a rate increase. What we received was the minimum rate increase rather than a higher rate increase on our
rate
product.
Increases for those 2 following years were over 10%.
Correct.
Whereas the 2 years before that were related to the following the particularly really bad claims years were at 8.5%, 8.6%. So I guess that's what I'm kind of challenged with here, understanding the stop-loss carriers' justification for those increases.
Actually, on the year that it was 10% 2014, I believe, they initially were out of the gate at 16% or somewhere in that neighborhood. Is that right, Mr. Huffman? And through discussions, they came to 10%. The book of business and its performance would have driven the 8.5%. Our large claims, the 2 prior year, somebody else is paying in premiums based on those because it is a fully insured model, and they look at what the experience run is for the whole, not just Rutherford County. And so that's why you see the rate increases the way that they are.
Okay.
And it does go to market. They do take it and look at it from a market perspective every year. at Cigna,
Stop-loss carrier?
and look at, y'all are the carrier on it, but they look at it, what their rates are comparative to market, and do their actuarial assumptions based on the book of business. Correct, right.
Also, another question on the same, on the stop-loss premium. You were talking a little bit about the funding and the fiduciary responsibility for making sure that the claims funds were funded well enough to make sure that claims got paid promptly. And I'm not sure, and I may have missed something at the beginning part of that. Did that come up because it's been a concern with our county plan in the past? Or were you just making a point of how important it is to do that? I mean, are we funding?
Yes, we are
appropriately?
funding. Yes, we are. And I can't speak for the years prior to me. I can just tell you that that is our responsibility, is to make sure that, you know, that's my main job, is to make sure that we have money available through premium collection to pay the bills. And so that's why I brought that up.
Okay. But
Yeah.
it hasn't been a problem for you?
No,
recently?
not to my knowledge, no.
It's taken care of.
Right.
On the funding that the company puts in for the high deductible plan, is that, you talked about, you know, how that works with, that goes to pay claims first. Is the employee's account fully funded at the beginning of the year, or is it stretched out over the course of a year?
Beginning of the year.
Okay, so if the county is putting in $750 towards my large deductible piece, then if I have a claim in January that's $1,000, that $750 is available immediately for.
That's correct. Yes. The other thing, too, is that they can actually roll that money over up to the full deductible amount, which is important to understand. So let's say that you have an employee who is at $750 and they use the MedPoint clinics all year long, right? They can roll that money over the next year. And they can continue to roll it over up to the full deductible amount. So they could actually bank the money to where they would never pay a penny out of pocket. And that speaks to one of those things about smart decisions on how you receive your services and care.
Yeah, and I know that the participation level in the high deductible plan is huge, and it looks like you guys have been very successful in getting those numbers up. I don't think I'd ever worked anywhere that has seen quite that kind of success at, 30% and higher, but I assume from what you shared that going on or moving into the future that we still continue to do the education pieces to make sure that employees really truly understand what benefits they can derive from being in that particular plan.
Right.
Because it is hard for a lot of them to swallow initially from a financial standpoint.
It is, and that's why the copay plan is a good stepping point. Now, to Cowan's benefit, I go back to the number of people that we have. I know that as I've looked through old documents, when they were here, when they came on in 2009, and I believe it may have been 2010, beginning, something like that, they actually talked to the commission about doing the open enrollment meetings, and I think they may have done them in 2009, where going out to every single school and over 100 meetings during a very, couple of weeks, and talking with people and being available, and Cigna comes as well. And, we haven't done that. We didn't do that last year because the participation starts to dwindle, so you got to react to that. But it has been through the different avenues of education that we have been able to get people into that program. And the biggest advocate for the program is the person that they sit next to at work that says, I've been in that for 5 years, right? So that's our best spokesperson.
I have $3,000 in my account
That's right.
this year available to pay for my surgery because I haven't used it the last
Right,
5 years.
that's right.
Okay, one more question. and
No problem.
I'll give other board members an opportunity. On the rate history page, if I'm understanding this correctly, I just want to make sure these are the rate increases of premiums that we passed on to the employees, correct?
This is total. I look at everything
is
from a
total.
total rate, right? Total rate increase,
But just medical?
just medical, yes.
Okay. All right. I think that's it. Thank you.
I warned you that
That's okay.
she had knowledge. As far as the bidding process, how often, as far as the carrier, how often is that rebid?
So our contracts are generally written on a 3-year with 2 one-year right of renewals. So it would be somewhere between 3 to 5 years. Yeah. And of course, you know, we do the legal notice and we go through the bid, you know, and you can look at all the insurance meetings. We'll bring them in, let them talk, have the discussions, and make sure that it's all very transparent. And that's one of the reasons why, you know, as I mentioned with Cowan and Cigna, I don't know what your interaction with them was prior to when I came, but coming from the TPA side and having a passion for insurance and seeing it as a financial tool that helps people, you know, it is part of your financial picture. And it really does help people fill a gap in their lives. And when I was at CNA and at my employer after that, I managed clinical staff. And even though I don't have a clinical background, I learned that I better learn very quickly if I'm going to manage nurses. So they taught me a lot, and I've learned a lot. And we're able to look at it multifaceted to make sure that people are getting what they need in the best method. This is not, for me, just a job where I'm here to put numbers down and collect a paycheck every other week. I really take a vested interest in people's lives and trying to help them figure out how to best utilize what's available to them. And I've educated a lot of people one-on-one, and I think you've heard me say it at the insurance meeting. I can't do them all during open enrollment, but if they were looking at a change for next year, I'm more than glad to sit down and do some analysis with them and help as best I can.
How much time do we have for open enrollment?
We generally allow 2 weeks for open enrollment.
Any way to stretch that a little bit and maybe give people a little more time to consider their options, especially if there's changes being made?
We've had as long as 6 weeks before, and here we are creatures of habit. Much like the biometric screening, where we gave them a year plus 2 months, 14 months, whatever the time frame was, everybody gets it in at the last minute. So even though I understand that having it longer seems to give more time to look at it, the opposite actually occurs, because they know it always happens right at the health fair and it ends around October the 31st. We always try to keep those same time frames so that there's that mental reminder with them. And it's just like studying for a test. You know it's on Friday. You tell yourself on Monday you're going to do it, and you don't, and Tuesday you don't, and Wednesday you don't, and you get worried about it about lunchtime on Thursday, and then you're up all night. And it's the same thing, because we all live very busy lives. So, but we've had Saturday open enrollment meetings where we've sat, and that's, you know, that's helped. They bring their spouses, their wives come, and or the husbands, and we educate them, and we'll work, you know, how we can to help them. But I really have seen taking it to 2 weeks gives the best response.
We have, you know, teachers is really not making a real good salary starting out. And then we hit them with a 24% increase in 1 year. That's a huge increase for our teachers to absorb, and anybody else as far as that goes.
Mm-hmm.
So with the trend that we're seeing, that's our concern. Is over the last 2 years, that we're seeing substantial numbers and increases, and we want to make sure that we're doing something to give back to the employees so that their pay increases not going toward insurance. I mean, nobody wants to work for just an insurance company. Mm-hmm. And so that's where we're concerned, and we want to see some kind of actions in place to try to deter these costs.
I can send you a document, which I have with me but didn't print off, and it's the plan changes that we've done since 2011. And just for visual, you can see, right, this is just since 2011, so you talk about how do we give back, right, here. We've expanded our services in the clinics. We have gone into the retail marketplace for them. We've actually done a lot for employees from the insurance program perspective to make things cheaper, more accessible, which ultimately affect the premiums. Our health clinics have had, since Premise Health took over, has had a 67% penetration rate. 67, 64, I'd have to pull the number. So we have over 30% of our folks who have never used the clinics. It does take initiative on both sides. There's not a magic wand to be waved here. Trend has been 8 to 10% for many, many years on the medical. Our experience shows that on the rate increases, even though we had that year that it was 24%, we're averaging about 5. So I know it was painful, and I know that we've done some things to control those costs that have been painful. But with the introduction of the wellness program and some of the things that we don't realize are good for us in the beginning, they show good results on the back end. And so, you know, we're trying to change the cell in the direction that we're going, at least in the time that I've been here. And it's been a long process. Like, you know, as I mentioned earlier, those programs were so close together in terms of what products we were offering. We had some educational pieces to do on the high deductible plans. That takes time to get people comfortable with it. So there were some foundational things we needed to build upon. And I think we're making progress, and I would be shocked if we saw. And as soon as I say that, I'm going to get some staggering report on my desk. But I think that because we are approaching it now, what is our budget? What does our budget need to be? Now, who's going to pay what? By separating those two things instead of lumping it together and saying, we can't do that, we can't pass on that much increase, those type of things, it has also defined our approach and direction as well.
And one other question, you said, I think you made a comment that a risk manager does not receive a commission.
So typically, or not typically, but often, there will be a broker on the product, so medical, dental, vision, and that broker will receive a commission. We are a direct contract with Cigna, therefore there are no commissions built in. So no one's receiving any payment for bringing that relationship to Rutherford County. It's a bid process, and Cigna has bidded as well as many others, and year over year, each bid, they have proven to have the lowest offering and the same services.
There are commissions being paid to them, but it's to a broker, not to the...
Not on those product lines, no. They're net of commission.
What you have is a consultant, and they're paid by the county.
No, what we have actually is a commission-based arrangement with them, but not on these product lines, which is actually better for the county. We don't have a capitated arrangement with them where we give them so much per head. We don't have a commission-based with them on the medical, dental, vision. They do receive commission on ancillary product lines, and they have acquired those commissions through the bid process. Our life insurance, we bid it. They bring a carrier under their broker umbrella. That carrier will submit it, and they'll say, okay, the number's $40. The next guy says, all right, 42, 47, 46. $40 being the cheapest rate is what we go with because that's the rate that is paid. There's already commissions built into that. That gets paid directly to them by the insurance company. That's not the same arrangement on our medical, dental, vision, pharmacy, stop loss. None of those have that type of arrangement. Whenever I came to Rutherford County, there was already in place the open enrollment meetings, the production of those pretty books that you all have, as well as the fulfillment of the packages, right? We speak the same language, and like I started out with, my ego's not big enough to not, listen to other people's opinions and go out and do some data research and discussions. And so I would begin to talk to Mr. Brown and say, what do y'all see in your book of business? What do you see in other governments do? Because we're already working with them on other things. And they were already working with Rutherford County in those type of discussions before I came. The difference is that I brought them to the table and said, hey, they're going to have questions about stuff you see in your book of business. I'm not the right person to answer that. Let's get another resource at the table so that you can answer that directly with them. So, and that's one of the things that they talked about with the commission is that they're a partner. They're about education and client services. I had never worked with these individuals at Cowan. Before I came, I knew of Cowan. There was a former employee of theirs. She was on some of the accounts that I had. She was a broker on them. I was familiar with her, but I've never dealt with her, and she's no longer with Cowan. So that's what the arrangement is. I mean, that's how they get their compensation is through these other product lines, but none of these that we're talking about tonight. And when we've bid those other product lines, we've had other brokers submit bids on those as well.
I just want to make sure we're leaving enough options out there to make good decisions.
Yeah. When we bid these particular lines, we do a full-blown RFP. We do the legal notice. We get them in from Blue Cross Blue Shield, Aetna, Cigna, all the ones that you would expect, down to the TPAs. We have copies of those bids. You're welcome to come look at them anytime you like. And you can see, we spreadsheet it all. We put it out to the insurance committee, let them look at it. And when this bid is, this period's up, we'll bid it again the same.
Ms. Moore?
Yeah, of course, I have another one. Just to clarify, to piggyback on Mr. Young's question, because I understood what he was asking, and I'd heard the same thing, but when you were talking about the no load or the no commission, you kept referring to Cigna, but were we actually talking about Cowan?
So Cigna is our direct relationship.
Cigna's the carrier.
They're the carrier, right. There is no broker in between us and Cigna. It's a direct contract with Rutherford County. We bid those product lines. We bid pharmacy, stop loss, vision, dental, medical, right? Cigna has come in with the lowest rates. How many bid cycles? Mr. Huffman, 3? I know it predates me since 2005. So,
What I'm really getting at or asking then is, if that is indeed Cigna that you're referring to, how are we paying Cowan?
Cowan Benefits gets paid through the ancillary products. So,
We're talking about Cowan when
yes, that's right. Those products are bid the same as well. So life insurance, long-term disability, short-term disability, the critical illness products, all of those are bid the same. On the bids that they have won, they will get commissions from those carriers, right? Cowan competes with large national consultant firms and brokerage firms.
And I know Cowan is a great organization.
And they're I know, but I'm saying this for the others. They are a local company. They're based out of Brentwood, right? And much like when I was at the TPA and we were competing with the Blue Crosses, United, Cignas, Aetnas, we had to do something a little different to differentiate us for being the local guy. And that's why we're able to get the level of service that we get from Cowan Benefits. And that's why they partner, is because they have to compete with the large brokerage firms, and they have to show their value and their ability to do those things. And so we benefit from that. Now, they've been compensated through the county since 2009 through the bids on those product lines. I did this when I worked at the TPA, and I negotiated those contracts. I figure if you have a contract and you're getting money from us, we need to get some work out of you. And they know it. Paul's back there grinning because he knows it, right? And I don't hesitate to go to them and say, hey, I'm one man deep. I've got Sherry Evelyn and 2 supports, right? What can you do to help me out here? How can we get this done? What are you seeing in the marketplace? And they have helped without receiving any commission on these product lines that I've mentioned in terms of tonight.
One more.
Yes, ma'am.
Have we ever explored the captive insurance market for insuring the county?
Yes, we have not, to my knowledge, looked at a captive insurance market since I've been here. There has been, I've talked about it, I've kind of dabbled in it a little bit. There's been other things that we really needed to work on, not just from getting the plans where they've needed to be, but also getting a lot of decision makers palatable to making those decisions. And you can see from some of the commission meetings, I mean, I do a lot of education and a lot of research, and I make sure I get all my ducks in a row, and, because I want to give them what they need to make those decisions. So, yes, I'm aware of it. I don't know that we're there, but I'm always looking for where are we going next? Will the next thing be for us in HSA? What will it be? What will be the best bang for our buck when it comes to employees?
Well, it's okay. We'll appreciate your input on this question. Anybody else?
I don't think there's anybody on this board that, at least in the year almost that I've been here, that hasn't had some sort of comments, and evidently you already know this, concern about the tons of money that we're putting into insurance and that our employees are putting into insurance. Obviously, we're all very concerned, and Mr. Young just stated it very well, as he has done before. Obviously, and it's our job to worry about the students, staff, teachers. I worry about other departments too, but our focus here is children and education. And we are concerned, well, we want this money for instruction in the classroom. And I think we're all frustrated, and that probably includes you. Because I know you're concerned about the entire county. You've got a lot of departments to worry about. Well, the rates, they're just going up at such an alarming rate that, and when we can foresee 6, 8, 10% ahead of time, and Mr. Sandvik over here has to figure that, and with his staff, and he does a tremendous job of sometimes guessing as to what the rates are going to be, but he's always pretty close. And then we go to the county commission with this figure, which shows 8, 10% rate increase, and it's in our budget that the taxpayers have to pay for, and it doesn't increase student learning one iota. And that concerns us, and I would imagine it also concerns you. I would guess. And the question that I asked the last time, and I probably maybe the meeting that you watched, I guess, was that is there anything that this board can do to, I'll use the word, soften the blow of insurance rates? Now, I've heard you before in front of the county commission when I was commissioner. And I have no problem whatsoever with the job you're doing. I know you and your personal history fairly well, and you spoke to it, so I'm speaking back at you. I know that this is a personal thing with you in some regards. Anyway, if you were in charge of nothing but lowering rates, is there something that this board is not doing? Is there a way that we could attack this in a different, maybe unconventional way? I mean, if we can look ahead, and I'm going to go ahead, I'm really speaking to the folks back here in the back now a little bit. I don't know if they've thought about this or not, but I'm going to quote Mr. Young again, which I do a lot because he seems to know just about everything. And he does. I wasn't being sarcastic. I'm being serious. I'm going to use the word he used. And I'm talking to you folks back there. I'm really very serious. There's no way for the county government to sustain this. This is not going to happen. The county commission is not going to do it. Next year, maybe, yeah, maybe. Okay. The year after that, another 10%? Maybe. Maybe they'll let the taxpayers do that. The year after that, maybe not. Then where do rates go? And what kind of mess are we in? Have I asked a question yet? I don't think I have.
I understand where you're going.
Okay. I think it's probably time for me to stop going. And you respond in any way you wish. And to keep in mind, I think we can agree that I'm pretty sure we're all on the same team here. I'm pretty certain of that.
So I do want to clarify one thing that you said. Although it's not my sole job, it is a significant part of my job. Maybe not to lower the rates, but sustain the rates and do everything that we can to keep the rates at the best rate that we can. My instant answer is probably some of the proposals that we could come back to say, hey, we can lower the county's contribution by X percent is going to come at the sacrifice of the employees. I'm not aware of a solution right now that will give them the same services, options, availability, coverage for the price that they're paying. And Ms. Dodd can tell you, we have we do about 500 new hires a year for the Board of Ed that we in process. And repeatedly, she will hear about the staggering rates from other counties and how grateful they are for our insurance. And when you get out of the model, I think Mr. Holliday said it at the last meeting, which is, you know, we're here because we want to be nimble and make these changes and do the things that we are specifically wanting to do for the county. That's why we're not on the state plan, among other reasons. Any of those other options that are out there, you're going to give up that ability and that control and that availability of programs and services. And there's always a trade-off. So can we get the number down? Possibly. Will it be a win-win? No. But we constantly scour and look and discuss, and that's why this team is here. Every one of them play a critical part every year that we're looking at rates. But certainly we are not going into this any year blindly. It's with eyes wide open, and we discuss and we project out and we talk about when the right timing is to introduce it, and we're constantly on the lookout for ways to bring value to the program.
Well, I suspected that would be your answer, and regrettably, I suspect that you're right.
Yeah.
I don't know that there is any major thing, and I'm reasonably sure that you would have found it probably if we could make a appreciable difference in our budget.
The defined contribution model could really impact the program significantly in terms of the dollars that's being paid out, but it would come at a very painstaking cost to the employees.
And we don't want that.
No, we don't.
We already got enough of that.
Right.
I think one of the things that is really difficult for most people to understand is the point that Ms. Moore made, is that, you know, that you not even touch the stop loss and you still get a 10% rate increase.
Mm-hmm.
And, you know, just that's just the nature of the beast with the insurance industry. Rates normally increase.
Yeah, when it's fully insured, you don't have that control. It's what their market is doing as to what drives that.
And I've had the opportunity for the last several months to attend the insurance meetings with our representative, Ms. Barnes and Mr. Sandvig, and I've learned quite a bit through those meetings, but I appreciate your effort and your due diligence, because I am confident that your heart is not only with saving the taxpayers those dollars, but to get the best value for our employees, and I'm confident that that is your mission.
Thank you. I appreciate your comments.
Anybody else? Well, we appreciate you visiting with us, and I hope your entourage isn't disappointed that they didn't get to speak to the
No, I
board.
told them they didn't have to prepare anything that you had asked. They would know off the cuff, so I'm glad that worked out.
And all the board members may have your email address, but if you could make sure that that is sent to every board
Yes.
member, that if later on this evening or sometime down, you know, in the next few days or weeks, if they had a question and could quickly email you,
Sure.
we would be grateful for that.
Ms. Barnes has it, and Mr. Savage, I think.
Okay.
Yeah, and I'm always willing to sit down and meet individually with you all, hear your ideas, you know, feedback. Because as Mr. Jordan said, we're all on the same team here, so
Good. Again, thank you so much.
thank you so much. I appreciate
Take
it.
care. Okay, I think we're ready for number 9, Mr. Odom.
Number 9 is the textbook adoption for a book not on the state list, Form ED 5196, local adoption of textbooks not on contract. The Instruction Department is requesting approval for local adoption of textbooks not on contract, not included in the official list of textbook. The first one is Better Chinese, Limited Liability Corporation, Discovering Chinese, Volume 1, grades 6 through 12, and Better Chinese, again, Discovering Chinese, Volume 2, grades 6 through 12. Recommend approval. The motion for Rutherford County to request approval for adoption of textbooks listed above which are not included in the official list of textbooks. Might explain a little bit of what this is. Central Magnet School is offering Chinese this year. The person teaching we're not paying for. It's coming to Confucius Institute, and also basically you're getting to offer the Chinese for the cost of the textbook. That's basically what we're saying right now, right, Mr. Zago? Yeah, they do some at campus too. Yeah.
Ms.
Chairman,
Moore?
so do the adoption of these textbooks, do they change the budget in any way in terms of what we had budgeted for textbooks? It's fabulous that we're getting the instruction for nothing, but minimal. Okay. I figured so, but thank you.
I'm not sure exactly how many. I did hear from Dr. Ash about how many were signing up. It wasn't a huge number, but it was a significant number.
Chinese being taught of other places in the state, do we know?
Oh, yeah. Mandarin Chinese.
Yeah. I think it's fabulous. It's good.
Number 10?
Number 10 is Midland Elementary School property purchase on Rocky Fork Road from Prime Land Company. Rutherford County School Board Attorney Jeff Reed and the school's engineering department has completed the due diligence for the 75 acres of property on Rocky Fork Road in Smyrna from Prime Land Company for the future middle and elementary schools. The property will be purchased at a cost of $35,000 per acre for a total of $2,625,000. The purchase has been funded by the full county commission. And we had about 2.7 funded. You got closing costs and things associated with it. That was kind of the estimate we had at the time. And recommend approval. The motion is to approve the purchase of 75 acres on Rocky Fork Road in Smyrna from Prime Land Company for a cost of $35,000 per acre for a total of $2,625,000. Jeff Reed, Board Attorney, will schedule and facilitate the closing. This is the same property you visited when you were going around and looking at property, if you remember, a few months back.
Exactly what is due diligence, Mr. Reed? Was that, was that negotiating? I think you negotiated a pretty good price there. That's my opinion from this
Well,
angle.
due diligence, when you do that, you're talking about running engineering, looking at title studies, make sure there's a good title of the property, make sure drainage is okay on the property, make sure the ground is suitable for a foundation to be built and things like that. So when you're talking about due diligence, that's really what you're talking about, more so than negotiating purchase price.
Well, as long as you're up there, who is the Prime Land Company? That's not it was not owned by an individual. None of that was.
No, Prime Land Company is composed of a number of partners who are local residents here in the Rutherford County area.
Okay, fair enough. Thank you.
Mr. Reed? Any other questions? Number 11.
Number 11 is kind of goes to some local management. This was asked for, put in the budget from our basically principals and all. So the 2015-16 general purpose school budget includes funding to cover the proposal Mr. Tim Tackett made in January of 2015 to allow up to 3 2% supplements, a total of 6% at our middle schools. Allot an additional 6% supplement amount per middle school to be disbursed at the principal's discretion based upon the viable activities in their school. The most likely uses would be for bowling, trap, swimming, archery, or dance. None of these have been supplemented at the middle school level. And here's some examples. Example A is School A has an unsupplemented trap program serving 50 students, an unsupplemented bowling program serving 25 students, and an unsupplemented archery program serving 30 students. The principal, in this instance, would be able to provide a 2% supplement to each previously unsupplemented activity. Example B would be School B has 55 players active on the football roster with only 2 supplemented assistant coaches, has 26 players active on the softball roster with no supplemented assistant coach, and 32 players active on the baseball team with no supplemented assistant coach. The principal in this instance would be able to provide a 2% supplement to each previously unsupplemented assistant coaches. Title IX rules must be considered when assigning these supplements. I remember in some instances for baseball, we didn't have a first base coach and a third base coach. If you remember we didn't have somebody supplemented to do both. Typically, you have somebody, standing next to the base there. The additional discretionary amount could not be used to raise a current supplement beyond the posted amount. Example, the current supplement for a middle school head football coach is 13%. This discretionary amount could not be used to raise the supplement to 14% or higher. Note, the additional discretionary amount could not be used to fund more than 1 additional assistant coach per activity. Example, the current supplement schedule allows for 2 supplemented assistant football coaches. This additional discretionary amount could not be used to fund more than 1 additional supplementary football assistant coach positions. The motion will be to recommend approval. Motion to approve the addition of up to 3 2% BS and 5-year athletic supplements for a total of 6% at our middle schools to be assigned at the principal's discretion to the viable activities at his or her school, subject to Title IX rules, and not to be used to increase any current supplements or funds more than 1 additional assistant coach per activity as presented.
We had quite a bit of discussion about this last time.
In some places archery was taking off, and in other places it may not have been, but another sport was. And so as we discussed it and talked about how do you lock everybody in to something, and part of your discussion was maybe we can give them some discretionary funds to allow them to meet the unique needs of their building, which is some site-based management type decisions. So this is a proposal Mr. Tackett came up with in this. Pretty good proposal.
Seems reasonable to me. What is a BS in 5 now? Anybody know?
Sandvik, what's about a BS in 5 average? Starting his hand, Mr. Jordan.
The entire world is in that machine right there.
We need some music.
That's schedule. It doesn't do it. Okay, okay. 682. Okay. I didn't remember.
So 2% of that, various supplements. And some of them are going to have to go, but it has to be even with Title IX, right?
You could.
System-wide or by each school?
I think you have to look at that school and see what's offered as far as Title IX offerings there, that you're not leaving out a female sport that might be for just a male sport.
Mm-hmm.
We always have to account for Title IX.
Okay. Thank you.
Ms. McLeod helps us with that one.
Anybody else? Number 12.
Number 12 is the transportation. Per Section 8 of the bus contract, which covers the assignability of a contract from the contract holder to another individual, the Transportation Department has received a letter from Linda Manitic, contractor of Bus 120, requesting that her daughter-in-law, Catherine Raposa, receive Bus 120's route due to health reasons. Ms. Mechanic. Thank you, sir. Mechanic has held this contract for Rutherford County Schools since 2008. Ms. Raposa is currently the full-time driver, has been a driver since 2013. So the motion is to approve the contract for Bus 20 to be transferred from Linda Mechanic to Catherine Raposa, effective immediately.
And it's been traditional for us to transfer to a family member when there's a health issue involved. Any questions regarding the transportation? Okay, we'll move on to general discussion. Anybody have anything tonight? We'll have another opportunity tomorrow night.
Well, have we thanked the county commission publicly?
I thought we'd do that tomorrow night.
Fine.
That's okay.
Wonderful. Let's just not forget to do it. They really came through for teachers and education.
And Mr. Young hit a grand slam with this motion, too. Pleased with this side of this.
Ms. Mitchell mentioned him in the paper. That's enough. We don't need to say any more.
Had no spotlight.
Anybody else? Again, we'll see you because of the summer law presentation. We'll be seeing this later on in the week. We're having both meetings here early part of the week. So we'll be back here again at 5 o'clock tomorrow evening. So, without any further ado, we stand adjourned.